has got some problem in achieving the sexual pleasure, they have to see the sexologist. Either the partner or the himself or herself are unable to satisfy the partner each quadrant from 4 fingers, and if nothing is felt, but still the penis is not listening to the hormone level, whether the testosterone and other.
Welcome, Dr. Sharath. Today, we have a few questions that our viewers and friends and well-wishers have asked, questions that they are curious to be answered. So the first question one of our viewer asked is, when do I see a sexologist?
A very pertinent question. See, whenever a man or a woman has got some problem in achieving the sexual pleasure, they have to see the sexologist. Either the partner or the himself or herself are unable to satisfy the partner, or both are not happy with the sexual activity, then they have to see a sexologist. That is in a nutshell. That is, whenever they are not enjoying their sexual activity, or unable to perform the act, or unable to satisfy the partner, maybe the male or the female, or even the lesbians or the gay couple. So if they're unable to enjoy the sexual activity themselves, or make the partner happy, then they have to see the sex.
So in short, if they're not able to get the pleasure, or they're not able
that's very important. Is the very purpose of sexual activity is to get the pleasure. That is one thing. The second thing is reproduction. So when they are unable to reproduce, then they will see the infertility specialist, or of course the sexologist also.
Right.
So the sexual activity is done mainly for two purposes. One, to achieve the pleasure for themselves, or give the pleasure to the opposite partner, or for procreation, that is for reproductive. Any of these three are not achieved, then they have to see the sexologist or the concerned infertility specialist if the problem is due to reproduction aspect.
Got it. Also, is erectile dysfunction treatable?
It is treatable. Say, erectile dysfunction earlier, before about the advent of this Viagra tablet, what we call it a sildenafil citrate tablet. Erectile dysfunction was not successfully treated, but after the advent of these medicines, especially sildenafil citrate, tadalafil, sildenafil, amonafil, treatment is very, very easy. And also latest treatments like platelet-rich plasma injection, PGE1 injection, papaverine injection, bimix injection, trimix injection, vacuum pump devices, constrictive devices, low energy shockwave therapy, acupuncture therapy, vibrator therapy. All these have made the erectile dysfunction easily treatable.
Right. So that's not something that they should lose hope over, but
no,
they
not
see a doctor such as yourself.
They are easily treatable. It's an easily treatable condition.
Right. So again, for women, right?
Yeah.
We are told to check our breasts often to check for breast cancer. So similarly, are males also asked to check their private parts?
Yeah, that's very, very important from the public health point of view. Women usually, when they are having their bath, shower, monthly once or 2 months once or 3 months once, while taking the bath, they should have the self-examination done by pressing the breast softly, delicately from the palm, divide the breast into the right and left, and in the right breast, divide it into four quadrants, right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Palpate each quadrant from 4 fingers, and if nothing is felt, check the nipple 2 or 3 fingers, and if there is no tenderness, no mass, then nothing. Same thing to be repeated to the opposite breast also. This is called as self-examination. During self-examination of the breast, if any lump is felt or if any tenderness is there, then they have to go to a specialist, a gynecologist, or a surgeon, or a sexologist, and get the breast examined, or directly go for mammographic examination and get the breast scan to rule out any mass or cancer. Same thing, men.
What about men?
They have to examine, monthly once or 3 months once, self-examination of the testicles, find out whether both it are normal, and if there is any tenderness or any mass or any swelling, then go to the doctor, a sexologist or a urologist, or directly go for testicular scanning. Get the scanning done and check the penis also. See whether the penis is normal, whether there is any lump inside or a hard mass inside the penis, or whether it is bent, or is the foreskin coming freely in and out. Check up. If there is any problem, consult the a sexologist or a urologist.
That's very important, doctor.
Yeah. Physical self-examination will give us what's going on inside the body, and that will early detection of any of the masses or tumors or cysts. The treatment will be very easy and it will be very successful also.
Exactly.
Delay in diagnosis will make the disease spread inside, and then the treatment may be difficult.
Correct. If somebody suffers from premature ejaculation, right, they want to know what are the dietary or lifestyle changes that can be made to help the problem.
Diet style modification may not help or to treat the premature ejaculation immediately. Diet, exercise, they are all long-term measures for the well-being of the body and to keep the body fit, physically fit. A physically fit body can do the sexual activity better than a person ill or who is obese or who is very thin built. So whatever the diet, exercise, lifestyle modification, they don't give immediate instantaneous results. For example, a person has got premature ejaculation, he will go and join the gym, and tomorrow his intravaginal ejaculatory time will not increase. He won't get dramatic results. Similarly, taking some vegetables, fruits. Okay, I've eaten vegetables and fruits now. Night, I will perform the sex for 10 minutes. No, it is not possible. So dietary changes, lifestyle modifications, quitting the smoking, quitting the alcohol, they will help in long run for the betterment of the general health rather than giving immediate results for the sexual health. Of course, it doesn't mean that they should not follow the diet and exercise. It is very, very important, but don't expect instantaneous results.
Correct. So there seems to be a lot of interest on erectile dysfunction. The next question is, how do you diagnose an erectile dysfunction?
Diagnosis is very simple. The person himself comes and says that his penis is not erect. He is unable to perform the sexual activity. He says that even when his partner is stimulating him, putting the hand on the penis and stimulating it, even when the partner is naked, all the visual and all the olfactory, all these systems are there in front of him, but still the penis is not listening to him. So he himself, it's a self-diagnosis. The patient comes and says, doctor, I am unable to get a rigid erection.
Right.
Or the erection is there, it is not rigid enough to insert into the vagina. Or it is there, but not satisfied. So the erection may be 75% erection, or 50% erection, or 25% erection. So we measure the rigidity, that is called a rigidity test. So we check the penis whether it is completely hard, 100% rigid, or the rigidity is only quarter or 50% or 75%. So erectile dysfunction may be complete or it may be moderate or mild. So we can differentiate, classify them into mild erectile dysfunction, moderate erectile dysfunction, and severe erectile dysfunction. Then, of course, the other tests are there to find out color Doppler test, hormone test. They're all diagnostic tools. But the simple and the foremost thing is the patient himself, he comes and declares that he has got ED.
So moving on to the next question, one of our viewers is asking, is surgery the only option if the foreskin on the penis is tight?
A very good question. When the foreskin is tight, it is called as phimosis. There are three grades: mild, moderate, and severe phimosis. Right. Mild phimosis is when the skin can be retracted when the penis is not erect. So when the penis is flaccid, when the glans penis is not big, that is flaccid penis, the person can retract the skin easily. That is mild phimosis. It is tight, but he can retract it. But when the penis is hard, that is when the penis size increases, he is unable to retract it. That is mild phimosis. In mild phimosis, the skin band can be retracted when the penis is flaccid. Moderate phimosis is he is unable to retract the skin easily even when it is flaccid. He will feel the pain. He can retract with lot of pressure. The opening is there, but cracks will occur when he tries to pull the skin back, retract the skin back. That is moderate. Severe phimosis is only a pinhole is seen in the prepuce. So it is totally closed. Only urine can come. You cannot see the glans penis. So severe phimosis, it cannot be treated by routine techniques. It's only surgery is the answer. Mild phimosis can be easily treated with applying local anesthetic gel and ask the patient to go on retracting the penis gently, daily, and expand the prepuce by one finger, putting the finger and rolling it out, and try to expand the prepuce daily. So for doing this retraction for 3 months, the prepuce becomes expanded. So just like dilatators, we dilate the cervix by putting the Hagar's dilators. Like that, the prepuce can also be dilated by stretching exercise, that is stretching the skin by holding the prepusal skin by more 4 fingers, right 2 fingers and left 2 fingers, stretch it gently, put silicone gel so that it will not hurt. So this can be done. And sometimes we can even apply steroid betanoid ointment, corticosteroid ointment, to help the skin to stretch easily. So mild phimosis can be treated by physical methods, by stretching. Moderate phimosis can be attempted, but may be very difficult to treat, because by doing this stretching exercise, the skin may tear, and it may cause infection, and it may cause the phimosis may increase because of the fibrosis of the skin. So mild can be treated by gel and exercise. Moderate one can attempt, but the results are not guaranteed. Severe phimosis, surgery is the only answer.
And is this painful, stretching of the skin?
Yeah, that's what we give a silicone ointment gel, so that the part becomes anesthetic, so that there will be no pain.
The next question from a friend is: I am in my early 20s, but I'm not interested in sex. Is this normal? Do I need to get some treatment?
It is male or female?
Male.
Loss of libido, we call it, or loss of desire, we call it technically. In men, at the age of 20, it is very uncommon, very uncommon. It's because most of the men at the age of 20, they'll be interested in the sex, not just interested, they will be very much interested in the sexual activity. So if there is lack of sexual activity or desire or libido, it calls for immediate examination of the person totally. That is, check all the internal and external genital organs, whether they are well developed, and check the hormone level, whether the testosterone and other sex hormones are perfectly okay. Why there is deficiency of the desire. So it requires for total exam. And also third thing is counseling. Ask the person whether he has got any inhibition towards the sex, whether he had any disastrous event which made him to avulsion towards the sexual activity during childhood or during adolescence. So any fear or any complex hindrance which he has got towards this one, psychological effect, that is psychological trauma. So, for example, one might have attempted the sexual activity when he was 17 or 18. The parents would have come. He would have been caught red-handed. That shock will make the person to remember always and not to go for the sexual activity. Or hurt, that is trauma during sexual activity. So he will never attempt the sexual activity again, because that was very painful, the first encounter. So like that. So there will be some psychological trauma or this one, which makes the person not to attempt for the sexual activity. These reasons are very common in girls, very uncommon in men. Anyhow, detailed examination and counseling is important.
And this can happen if somebody has gone through sexual abuse or rape also.
Yeah, that's what. All those things happen more for the women. That's why I asked whether the person who has asked the question, is it man or woman? Because this sexual abuse, rape, then all sorts of molestations and misuse of the opportunity, that makes the girls usually aversion towards the sexual activity. So they start avoiding the sexual activity because of their bad experience earlier.